What's up, people? How are you going with pharmacodynamics chapter? Are you understanding it properly? So do write in the comment section. Watch the previous video parts before getting started. Two main topics we are going to cover in this part 4 pharmacodynamics: drug dosage and the factor modifying drug action. So stay tuned, focus, and watch the video till the end. Okay, so here we are. What is pharmacodynamics? Basically, what drug does to the body. So in this video, two topics, right? The main topics: drug dosage and the factors modifying drug action. Okay, now what is drug dosage? The amount of drug needed to produce a degree of response in a patient. Okay, मतलब कितनी drug required है to produce a particular response. Okay, now different responses from a drug, they require different doses. For example, we are having aspirin. Okay, so aspirin is having different properties over here: analgesic property, anti-inflammatory property, anti-platelet property. Okay, so for each of these properties we are having a different dosage, right? So for example, we are having a different dose for analgesic property of aspirin. We are giving aspirin only, but different dose of aspirin for different responses. So that is what it says. Okay, now dose depends on inherent property of the drug. Obviously it depends on the potency of the drug. Okay, now more the less the dosage of drug required to produce a particular response, the more potent is the drug. We know what drug potency is, right? So dose depends on the inherent property potency of the drug, right? Now the different kinds of dose we are having: a standard dose, regulated dose, a target level dose, and titrated dose. Now what is standard dose? So here same dose is appropriate for most patients. Wide safety margin, examples are oral contraceptives and penicillin. So एक ही डोज को आप ज़्यादातर पेशेंट्स को दे सकते हो. वाइड सेफ्टी मार्जिन है, मतलब सिवियर एडवर्स इफेक्ट्स नहीं होने वाले, साइड इफेक्ट्स नहीं होने वाले ज़्यादा. Oral contraceptives or penicillin are the examples for standard dose. Now the regulated dose. Dosage is accurately adjusted by repeated measurement of the response. Now you're going to measure the response. When you give the dose, you're going to measure the response. Now accordingly, अगर response सही आ रहा है, ओके, रिस्पॉन्स कम आ रहा है, ज़्यादा आ रहा है, उस अकॉर्डिंगली आप ड्रग के डोज को भी ऑल्टर करोगे, चेंज करोगे, मॉडिफाई करोगे. सो दैट इज़ व्हाट हैपन्स इन रेगुलेटेड डोज. फॉर एग्जांपल वी आर हैविंग इज जनरल एनेस्थीसिया. नाउ द टारगेट लेवल डोज. Now these are the for drugs whose effects are not easily quantifiable and safety margin is low. Okay, now those drugs जहाँ पे आप क्वान्टिफाई नहीं कर सकते कि उसका रिस्पॉन्स कम आ रहा है, ज़्यादा आ रहा है, कैसा आ रहा है, तो उस केस में, और उसकी सेफ्टी मार्जिन भी लो है अगर उस ड्रग की, दैट मीन्स एडवर्स इफेक्ट्स कैन बी प्रोड्यूस्ड अगर आप उसका डोज कम ज़्यादा करोगे. ओके, सो व्हाट विल वी डू इन दैट केस? Dose is aimed to achieve a certain plasma concentration which has defined to be in therapeutic range. So we will aim and dosage. We will aim a dose. Okay, what do we aim at? To achieve a certain plasma concentration. Okay, मतलब हम एक डोज देंगे जिससे एक पर्टिकुलर प्लाज्मा कॉन्सेंट्रेशन रीच हो सके विच इज़ अंडर द थेराप्यूटिक रेंज. वी नो वॉट इज़ थेराप्यूटिक रेंज. ओके, वी एक्सप्लेन्ड इट इन द प्रीवियस पार्ट्स. Just to brief it up, it is the gap between the minimal therapeutic action and the maximal adverse effect action. Okay, now the example we are having here is antidepressants, right? So target level dose is given for antidepressants. Now titrated dose, what is it? A compromise between submaximal therapeutic effect and the tolerable side effects. Now in titrated dose we are having some drugs जिनको आप इतना डोजेज, उसका इतना डोज नहीं दे सकते कि मैक्सिमल थेराप्यूटिक इफ़ेक्ट रीच कर सके. क्यों नहीं दे सकते? बिकॉज उनके एडवर्स इफ़ेक्ट्स काफ़ी सिवियर होते हैं. Okay, so we are going to establish a compromise between the submaximal therapeutic effect and the tolerable side effects. So we will only give that much dose of the drug जिससे जो side effects है वो tolerable हो. Okay, हम tolerate तो कर सके कम से कम, right? Now the anti-cancer drugs, we know that anti-cancer drugs are having very severe side effects, so it is the example for titrated dose. Now the second slide we are having is fixed dose combinations. It is a subtopic under drug dosage, right? Now fixed dose, as the name suggests, it is a pharmaceutical preparation containing two or more doses drugs in a fixed dose ratio. So we're having a fixed ratio, okay, of two or more drugs. Now the advantages and disadvantages we are having of this combination, kind of combinations, right? Now the advantages are convenience. It is convenient if we are having a particular combination ratio, right? So it's easier to take like one package once a day, right? Now the synergistic action of drug combination, the second one. Now we know obviously that if we are combining drugs, they may act as synergistically to each other or antagonistically to each other. Now we have now as we have prepared these combinations, okay, so we have taken care that these particular drug combinations, they should act synergistically with each other, so they should increase each other's action, right? Now the third one, less side effects. So this is based on the fact that when different drug combinations are given, when different drugs are combined, their action, their therapeutic action, it is going to get added up, right? But their side effects, they do not get added up, okay? So obviously we are going to have less side effects as compared to a single drug which is given in more dosage, okay? Now importance in tuberculosis treatment and HIV/AIDS. So we are giving a combination therapy in these diseases, right? Now the disadvantages. It is difficult to alter the dose of the drugs. Obviously when we are giving a combination of 2 3 drugs, it is obviously in a fixed dose ratio, so it is difficult then, if the patient wants, if the patient requires the drug A more, the drug B less, so we are not thinking that much, okay, we are just prescribing the fixed dose ratio. Now the second one, additional side effects when the patient do not need all the drugs. So if the patient do not need the C drug, he just needs the drug A and the drug B. So obviously if you are giving the fixed dose combinations, side effects are going to be increased, because we are giving such drugs to the patient which he doesn't even require, right? So yeah, that's what fixed dose combinations are, okay? Now the a very very big topic but important one, factors modifying drug action. So what are we having here? Some not some many factors which modify drug action, okay? So these some of these are obvious, some of these are new to us, okay? So let's see what it is, and yeah, how it influences. Now individuals have different pharmacokinetics, number of receptors, host and environmental factors. So we all know that different individuals, they are having different factors working in their body, they all are different, right? So different pharmacokinetics, a different number of receptors, and many different things, okay? Now the factors modifying drug action, how can they modify? They either can do it by quantitative action or by qualitative action. नाउ यानी कि जो सारे फैक्टर्स हम पढ़ने वाले हैं, ये ड्रग एक्शन को मॉडिफाई करेंगे। कैसे करेंगे? ये तो क्वांटिटेटिवली या क्वालिटेटिवली। क्वांटिटेटिवली ये करते हैं बाय इंक्रीजिंग और डिक्रीजिंग द एक्शन ऑफ ड्रग, एंड क्वालिटेटिव इट कैन डू बाय ऑल्टरिंग द रिस्पॉन्स, ओके? सो या तो ड्रग के रिस्पॉन्स को ऑल्टर कर दो या ड्रग को बढ़ा दो, कम कर दो। सो ऑल्टरिंग में हम एलर्जी एंड इडियोसिंक्रेसी, बोथ ऑफ दीज कैन हैपन, right? So what is idiosyncrasy? For those, it is a term which is used to define that for some diseases, the the cause, if the cause is not known for a disease, it is included under idiosyncrasy, right? Now starting with the factors, the first one, body size. So it influences concentration of drug obtained at the site of action. Okay, so different sizes we are having of people. Some are very very obese, some are thin. So obviously it is going to have a huge impact on the concentration of drug which is going to be present at the site of action. तो ड्रग कॉम्बिनेशन बढ़ सकती है, कम हो सकती है, राइट, उस पर डिपेंड करेगा, एब्जॉर्प्शन वगैरह काफ़ी चीज़ें डिपेंड करेगी कि बॉडी की साइज़ कैसी है. सो फॉर एग्जांपल, obviously we should give different doses to children and obese people, okay, based on their different body sizes. Now the age, children have physiological differences from adults. So children, they are not small adults. They some people, they think that they are small adults. Whenever we give to children, we give tablets, we just give half tablet, we think they are half adults, but it's not like that. Children, they have physiological differences, like they are having some differences from adults, okay. So some drugs, if they are causing some adverse effects to children, so children can be more prone to those adverse effects. For example, corticosteroids, they can suppress the growth of children. So while these do not can do so in adults, because it's very growth is very important in children, we know that. So obviously, care should be taken when we are giving drugs to children, okay. Now, what about elders have renal function declining, so drug doses, they have to be reduced. So mainly, in most of the adults, the kidney does not function properly, right. So obviously the excretion is influenced. Now, drug can be accumulated, it can cause toxicity there, so obviously dose, it should be reduced there. Now, in elderly males, due to prostatism, even mild anticholinergic activity of drug can accentuate bladder voiding difficulty. Now, elderly people, most of them are having prostate gland जो होता है, it's not working properly, right? So they are already having some difficulty in urinating. So if we give anticholinergic drugs, what it's going to do? It's going to make the bladder voiding more difficult. It is going to make the urinating more difficult. So that is why care should be taken when we are we need to consider age also, right. So these are the factors which we need to consider, because these are going to modify the drug action. Now the third one, sex. In women, dose must be given considering menstruation, pregnancy, and lactation. So these are the processes where sensitive women are more sensitive, okay, in these periods. So obviously, consider these things have to be considered while giving dosage to women. For example, drugs during pregnancy, they can affect the fetus, so that is why if it's not important, drugs are not given to pregnant women, right. Now the species and race, so different species, different races, they are having differences in responsiveness to the drugs. So they respond to the drugs differently, right. Now the genetics, a dose of drug to produce same effect varies among different individuals due to different rates of drug metabolism. So we saw that everyone is different, and obviously genetics is behind all this, and we are having different responses in different individuals due to differences in genetics. Now, a term here in genetics we are having is pharmacogenomics. So it is a branch of pharmacology which is using genetic information to guide the choice of drug on individual basis. So we know that every individual is different. It is everyone is having different genetic information, everyone is genetically different. So this is a branch in which the drug, for example, a patient, so on individual basis, different individuals, they are going to respond to a drug differently, okay. So this branch, it considers genetic information to guide the choice of drug for a particular person, okay. Now the sixth one, route of administration. Now we are having different routes: oral, rectal, parenteral. So these governs speed and intensity of drug response. Obviously, if we are giving drugs sublingually, it is going to have faster action, the speed is going to get changed, and intensity is going to get changed. So this is what happens in route of administration as compared to the oral route, okay. Now environmental factors and the time of administration, it is also having some role. Now, exposure to insecticides, carcinogens, tobacco smoke, um, all these can induce the drug metabolism. Okay, so drug is no longer acting, so the long action of drug, it can get diminished because excretion is more. Okay, metabolism is more, a drug can get inactivated. Now the type of diet, it can also alter drug absorption. So the more so what you're eating, it also obviously influences drug absorption. So these are some environmental external factors. Okay, now seven factors we have seen. The eighth one, psychological. So psychology obviously related with brain. Efficacy of a drug is affected by patient's beliefs, attitude. Okay, so what a patient believe, what his attitude is about, okay, the drug. Now उस पे भी drug की efficacy, उसकी efficiency depend करने वाली है. So this happens mostly with centrally acting drugs, those drugs which are acting on CNS. So for example, we are having a nervous patient, which obviously would require more general anesthesia. So if we want to give anesthesia to a patient, now if he is anxious, he is nervous, he's going to require more drug, the anesthesia. Okay, so what it suggests that obviously the brain, the central nervous system, it is going to affect the response of the drug. Okay, now placebo effect. What happens in placebo effect? Inert substance, we are having an inert substance which is called placebo, which is given in the place of medicine, and it produces equivalent response to the active drug. Now here in this effect, we are actually we are altering it by psychodynamic means. Okay, so what we are doing, we are just giving an inert substance which is in the place of drug. Okay, so why we are doing this? Because the physician, he doesn't think that the patient even requires the drug, but the patient is of the opinion that he requires the drug, right? So in that case, what physician does, he gives an inert substance in place of the drug. And as the patient is having some belief system, some attitude, so in the patient, what is going to happen, response is going to produced by that inert substance and not by the drug. So that is what happens in this effect called placebo effect. Now the ninth one, pathological states. So here some diseases, they can influence drug deposition, action, absorption. Okay, so these are the diseases which are going to influence influence the response of the drug. For example, we are having liver disease. What is going to happen in this? Bioavailability of the drug with high first pass metabolism is going to get increased. So we know what bioavailability is, we know what high first pass metabolism drugs are there. Okay, we know what are they. So they are basically those drugs which cannot be taken orally. Why they cannot be taken orally? Because they're going to get inactivated in the liver. So if the liver is having a disease, so it won't be able to deactivate the drug as properly as it can do when in normal state. So bioavailability can be altered in liver disease. Now the serum albumin, it is going to get decreased, so protein binding of drug is reduced. Okay, now a serum albumin, we know that it is the protein which binds to the drugs. Okay, so we were having some kind of protein binding when the drug reaches the circulation, systemic circulation. So in the liver disease, what happens is liver is obviously producing this albumin, so it decreases in the liver disease and the protein binding is going to get reduced, and obviously most of the drug would be present in free state. Okay, now metabolism and elimination is also decreased. We know what liver does actually, it metabolizes and it eliminates. So obviously these things also affect it. Now prodrugs, so we know that liver, it converts, when the metabolism happens, it converts prodrugs into active ones. So if we are having disease in the liver, prodrugs needing hepatic metabolism for activation, they are going to be less effective, we know that. We get it right. So kidney disease. Kidney disease में क्या होगा? Clearance of drugs are going to be reduced. Clearance. We know that what clearance is. It is it is a volume of drug which is going to get cleared from a particular plasma concentration, right? Now, kidney disease में obviously kidneys for excretion and clearance is going to get reduced. Now, congestive heart failure. Now in this modified volume of distribution, you know, heart, what it does, it's going to distribute the drug along with the circulation, right? So so that is what happens in congestive heart failure. The volume of distribution is going to get modified, right? Now we saw the nine factors we saw already, and now the 10th one. Don't worry, only 12 are there, so these two are the last ones, okay? And you can obviously this is the last slide, so just a little more patience, okay? Now the 10th one, other drugs modify response by interacting with each other. The 11th one, cumulation, is right here. Just see that, okay? Now other drugs में क्या हो रहा है कि कुछ drugs response को modify करती हैं by interacting with each other. So drug interaction. So 10th point we are having is drug interaction. The 11th, cumulation. What happens in cumulation? A drug will accumulate in the body if rate of administration is more than rate of elimination. We know that. अगर एडमिनिस्ट्रेशन ज़्यादा हो रहा है, एलिमिनेशन कम हो रहा है, तो एक्यूमुलेट होने वाली है बॉडी में, एक्यूमुलेट हो जाएगी, टॉक्सिसिटी हो जाएगी, और उससे रिस्पॉन्स ऑब्वियसली ऑल्टर हो जाएगा, मॉडिफाई हो जाएगा. नाउ द 12th वन, टॉलरेंस. टॉलरेंस इज रियली इंटरेस्टिंग. In this, it is a requirement of higher dose of drug to produce a given response. Okay, so before we were requiring less response, and now with time something has happened that now we are requiring higher dose of drug. So what has happened? It is probably mainly due to more excretion, or cells of target organ becomes less responsive. So what may have happened? Yeah, 2 minutes. So what can happen? More excretion can be there, or the cells of target organ, they can become less responsive, okay? Now what can be the various types of it? It can be natural or it can be acquired. In natural, where individual is inherently less sensitive to the drug. And what happens in acquired, where repeated use of drug in an individual who has initial responsive. Okay, so tolerance can be natural, where it is naturally present, and it can be of acquired type, where repeated use of drug is there in an individual who was initially responsive, but now it is not able to give that much response which it used to give earlier, right? Now the cross tolerance. What happens here is the development of tolerance to pharmacologically related drugs. Okay, so here tolerance is developed to not just a drug which is given more, but to the related drugs also. Okay, for example, someone is alcoholic, right? So it is again relatively tolerant to general anesthesia. Why? Because general anesthesia is pharmacologically related to alcohol. So that is what cross tolerance is. You got it right. Now tachyphylaxis, again it is a term for rapid development of tolerance when doses of drug are repeated in quick succession. So we are giving doses in quick succession again and again, fast and fast, so rapid development हो जाएगा tolerance का. So that is what it is, tachyphylaxis. Now drug resistance, it refers to tolerance of microbes to antibiotics. Okay, so the microbes, they have become tolerant to the antibiotics. For example, staphylococcus, it has become tolerant to penicillin, right? So that is what we saw in this video. That's it, guys. So for a quick recap, we saw what drug dosage is, we saw what is fixed dose combinations, we saw the various factors. We had 12 factors there. Okay, now it's time to leave. That's it. Thank you so much. If you liked it, do like, share and subscribe my channel. And yeah, that's it. Keep studying. I'll see you.